Hi, my name is Kristin Bernstein, and today we're going to talk about proton pump inhibitors. This presentation is meant to be given to Term 5 Bachelor's of Nursing students in the classroom environment during their pharmacology course. All of our students have completed a variety of prerequisite courses that are strong in the sciences in order to give them a background in these areas. They also are mostly traditional age during completion of the program. They also are expected to have completed all of their assigned readings before coming to class today, so that they are able to participate in a more active learning environment after this overview and then create an educational plan for their patients. Our learning objectives for today are to describe the mechanism of action of proton pump inhibitors, identify the side effects associated with use of proton pump inhibitors, and then, as stated, they're going to develop an educational plan for their patients to include side effects for PPIs, lifestyle modifications for people with GERD, and alternative over-the-counter medications that are available. Content process. We are going to review the information in the following order. We will start with the pathophysiology of gastroesophageal reflux disorder, or GERD. We'll talk about the mechanism of action of proton pump inhibitors, and then we will review the side effects and contraindications of proton pump inhibitors, the alternative treatment options, and the lifestyle modifications for patients to consider. So, pathophysiology of GERD. In order to adequately digest food, the stomach must secrete gastric secretions in order to break things down. So this is mostly hydrochloric acid. So we've got our stomach, our esophagus that brings food down and sends it off into the small intestine to continue being digested. So within the stomach, we have oxinic glands, which contain parietal cells, which create the proton pumps. So these proton pumps are what pump out our hydrochloric acid into the stomach. Now, as long as this acid stays in the stomach, we don't have any problems. The food enters the stomach, the acid goes at it, breaks it down, and things move along. If there's an overproduction of this acid and it starts to reflux into the esophagus, or this sphincter here that controls that flow and is only supposed to let things in, weakens and allows things to start going back up, then the esophageal lining becomes exposed to this hydrochloric acid. And it's more sensitive. It's not used to that. It's not designed for that. And so it becomes very irritated and inflamed. And that creates that pain that most people refer to as heartburn, the pain that's associated with GERD. So, in order to lessen that pain, we can take a proton pump inhibitor to stop those proton pumps from pumping acid into the stomach, so that if those secretions do go up into the esophagus, there's not as much acid, and so the esophagus doesn't become as inflamed. So in order for the PPIs to be best effective, they need to bind to the most proton pumps possible. Now, the proton pumps are most active right after we eat. So that's why PPI should be taken 30 minutes to an hour prior to a meal. So the proton pump inhibitors enter the stomach, they're digested, they become active, and then they irreversibly bind to the proton pumps, making them incapable of producing acid. So then the parietal cells are forced to create entirely new proton pumps in order to resume the creation of the acid. That process can take 18 to 24 hours. So that's why the PPIs are effective for that length of time, and most people only need to take them once a day. So the side effects of our proton pump inhibitors can include headaches and dizziness, some GI symptoms such as diarrhea, constipation, an upset stomach, vomiting, or stomach pain. Sometimes you can have some cough and cold symptoms, though most people do tolerate PPIs pretty well, and you don't see all that many side effects. Long-term use of proton pump inhibitors is also associated with a few things, somewhat related to the changes that they cause in the system because of the lack of acid. So that changes your ability to absorb vitamin B12 and to absorb calcium, so that you can have an increased risk of fractures and vitamin B12 deficiency. Also, the lack of acid can change the flora within the intestines, and so you have a higher risk of C. diff enteritis. There's been some links to dementia, which is not very well understood yet, and there's gastric premalignant lesions and pneumonia that can be associated with long-term use of PPIs. Though most people, if using PPIs over the counter, should only be taking them for up to 2 weeks at a time, according to the FDA. If they're needed further than that, you really should encourage your patients to be talking to their healthcare provider about what their best options are. So the contraindications to use of PPIs, of course, a hypersensitivity or allergy to them. They must be used in caution with severe hepatic disease, and most are pregnancy category B, with omeprazole being a pregnancy category C, so there's not as much research there, so this should be something to consider in patients who are trying to become pregnant or who are pregnant. PPIs can also affect the absorption and or the metabolism of certain drugs, and so you need to encourage your patients to consult with their doctor if they are on warfarin, any prescription antifungal medications, diazepam, or digoxin. So there are some other over-the-counter options for people with GERD. These include antacids, which instead of preventing the reflux in the first place and the heartburn in the first place, they can treat it after the fact. So they will neutralize the acid that is in the esophagus, providing relief of the heartburn symptoms relatively quickly. But they do not really decrease the overall gastric pH, and so they won't prevent subsequent episodes. The other prevention option is to take histamine 2 receptor antagonists, H2RAs. They can also provide relief of heartburn symptoms once they are already occurring, and they block the histamine pathway for stimulation of the acid production. However, the body can become accustomed to these and build up a tolerance, and therefore they don't work for long-term use, and therefore PPIs are preferred over them. It's also important to educate your patients about lifestyle modifications so that maybe they don't even need to be on these medications, or they only need to be on them short term if they employ some of these modifications in order to prevent their symptoms. So they should avoid smoking, avoid eating really large meals or eating right before bed. Some patients can identify trigger foods that lead to their symptoms, such as fatty or fried foods. Drinking alcohol or coffee can lead to GERD, and some medications such as aspirin can also contribute to GERD symptoms. So, in order to evaluate our students' learning after this presentation, they will be given a quiz at the end of this week that will cover not only PPIs but all of the gastrointestinal medications that we've reviewed over the course of the week. And then right after we complete this presentation, the students will have the rest of our class time and will be expected tomorrow to present an educational plan for their patients, which can be either a pamphlet or a brief presentation for the patient with GERD that's going to include the lifestyle modifications, the side effects, and it'll give the students a little bit of practice of how to put all of this into words that their patients can understand well. Links to objectives. So in order to describe the mechanism of action of proton pump inhibitors, we went over the GERD pathophysiology and we reviewed the mechanism of action of the PPIs. We reviewed side effects, both short and long term, so the students could identify those. And then our review of the alternative medication options, the side effects, the lifestyle modifications, and the aggravators of GERD. These are all things that the students can include in their educational plan for their patients. And these are our references. Thank you very much for watching. Have a good day.